Welcome back to the channel. I'm going to be giving you some really important advice today on what to do before you start chemotherapy treatment. These are all things that your oncologist or healthcare team likely didn't mention. I know this to be true because I've been working in radiation oncology for over 16 years, and I've always found it extremely frustrating that cancer patients don't receive the education and support they deserve after a diagnosis. And that's exactly why I started this channel. So if you want valuable information on cancer treatment, side effect management, prevention, and powerful coping strategies, click the subscribe button below so you don't miss out. Now, there are several things to consider before you start chemo. Your doctor will determine which chemo drugs or cocktail of drugs will be most effective for you and your unique diagnosis. But unfortunately, there's no way of predicting which side effects you will experience since everyone responds differently to chemo. However, it doesn't hurt to prepare yourself, both physically and mentally, for the side effects that are most common. So without further ado, here are 10 ways to prepare for chemo. Number 1, schedule a dentist appointment to have your teeth cleaned or any other dental work you need to have done beforehand. Several types of chemotherapy drugs can affect the inside of your mouth and teeth. While you're undergoing chemo, you should not be going to visit the dentist as a precautionary measure to avoid infection. Also, after you've finished all your chemo treatments, ask your doctor when it's safe for you to go back to the dentist. They'll most likely advise you to wait at least 4 weeks to have your teeth cleaned after you've finished treatment. Number 2, and this one's big, mentally prepare yourself for hair loss. Our hair is a huge part of our identity, and honestly, it can be traumatic to watch it fall out. So something that most people find helpful is to cut it as short as possible before they start to lose it, so it's not as much of a shock. Especially if you have long hair, start by cutting it into a bob to begin with, then gradually go shorter and shorter. There are also thousands of beautiful wigs or head coverings online, and some are even free for people with cancer. If you do decide to purchase a wig, those that are 100% pure human hair, aka Remy hair, will always give you a more natural look. I've included a couple of links in the description below this video of organizations that can help to hook you up with a free wig. A wig is also a great way to see how you would look with a different hairstyle. I mean, some people prefer to find one that matches their own hair, but if you've ever wondered what you look like with long blonde hair or short red hair, now's the time to try. Another option is to try cold capping. So the idea with a cold cap is that it freezes your head and narrows the blood vessels so that less of the chemo drugs reach your hair follicles. In turn, your hair is less likely to fall out. You can read more about it in the link below this video. I've personally seen some patients have success with cold capping, but it's not easy. I'm not going to get into the details in this video, but again, you can read all about it in the link below. So along with your hair, unfortunately, chemo will make you lose your eyelashes and eyebrows as well. The good news is there's a number of products on the market that won't necessarily keep them from falling out, but will really help with regrowth. EYELASH and Rapid Lash are 2 popular serums that can be purchased online or at some drugstores. Or Latisse, which is my personal favorite, is another popular one, but it requires a prescription to purchase it. It's known to be more effective because it contains a medical ingredient which has been scientifically proven to make your lashes grow thicker and longer. The other thing to mention is that Latisse isn't prescribed by your family doctor or oncologist. It's typically only available at medical salons or high-end spas, and it is quite a bit more expensive than other lash serums. Tip number 3, prepare for skin and nail changes. Chemo can make your skin extremely dry and sensitive. It's important that you keep your skin moisturized with an all-natural moisturizer like Glaxol-based cream or fragrance-free Lubriderm. These are considered to be safe because they don't contain any harsh chemicals or perfumes. Chemo can also make your nails darken and even fall off. But some people have had success in keeping their nails by always having them painted with an all-natural nail polish throughout their treatment. These all-natural brands can be purchased at stores like Whole Foods or other natural food stores. Please note, however, that it's not advisable to visit a nail salon while you're going through treatment. As I mentioned previously, you will be much more susceptible to infection, so you'll need to be as careful as possible. Tip number 4, stock up on healthy groceries and meal prep before your treatment. One of the most common side effects from chemo is fatigue. Preparing meals ahead of time while you have the energy will be extremely helpful later on if you're feeling tired and nauseous or worse. Ideally, you'll want to prepare and freeze as many meals as possible so you'll have them readily available. While you're preparing these meals, keep in mind that chemo can also cause you to lose your taste buds and have aversions to certain foods. Again, everyone's different in terms of the side effects they experience from chemo, so please try not to worry about them unless they do affect you. But when you're preparing meals in advance, keep in mind that several people have aversions to fish, strong spices, and greasy foods while they're on treatment. Tip number 5, you need to pack a chemo bag for your appointment. If your chemotherapy is going to be administered by IV, meaning you're having infusions or injections, you're going to need to pack a bag and be prepared to be there for a while. It typically takes at least a few hours to administer a full dose of chemotherapy. So unless you plan on sleeping most of the time, which is totally acceptable, it can get very boring sitting in the same spot for half the day. So in your chemo bag, you'll want to include things to keep you busy. A book, a phone charger, crossword puzzles. You can also pre-book phone dates with your friends to help keep you preoccupied during the session. It's completely normal to feel anxious during your first few treatments, so some people find it helpful to bring headphones to listen to some relaxing music, podcast, or even a guided meditation. My favorite free meditation app is called Instant Timer, but there are other apps called Headspace or Calm which are also popular. Number 6, wear comfortable layers of clothing. As I just mentioned, if you're going to be sitting in the cold hospital for hours, you'll want to dress in a lot of layers and bring some warm socks and a blanket. It would also be a good idea to bring a thermos with some warm water with lemon or some herbal tea. Number 7, hydrate. Chemo can dehydrate you to the nth degree. Be sure to drink plenty of fluids before, during, and after chemo treatment. Also, and this is huge, when you're hydrated, it's easier for nurses to find your veins when they're trying to insert an IV line. So try not to bring beverages with caffeine like coffee or green tea because caffeine will also make you dehydrated. Number 8, prepare for nausea and changes to your taste buds. Unfortunately, nausea is one of the most common side effects from chemo and definitely the most unpleasant. Your oncologist will likely prescribe you medication to make it subside, but often these medications can make you quite drowsy. Sometimes it can be difficult to figure out which medications work best for you, so it's important to always communicate with your healthcare team if something's not working so you can try something new. And as if nausea is not bad enough, some people also lose their taste buds, as I mentioned earlier. Although this is only temporary, it can be hard to maintain your current weight since you may no longer even enjoy your favorite foods or eating in general. Even if you don't feel like eating, it's incredibly important to consume enough nutrients in any shape or form in order to provide your body with the energy it needs to heal. Try bringing bland snacks with you to chemo, like crackers, toast, nuts, or even a vanilla protein shake. Number 9, accept all the help you can get. This may sound simple, but most of us are so self-sufficient that it can be hard to accept the help and support of others when they offer. But trust me, this will be a time when you could use some help. Help in running errands, cleaning the house, driving you to and from your treatment, or offering emotional support. It's best to allow yourself time to rest and recover without stressing about things like house chores. Most people want to help, but they don't know how. So if your friend asks you to let them know if you need anything, tell them exactly how they can help and that you'd be extremely grateful for their support. And finally, number 10, keep a journal. Even if you're not an eloquent writer, people often find that keeping track of their feelings and treatment side effects helps them to come to terms with them. This can also be helpful later on if you decide to share your experience with others who are in the same position. It's really helpful to acknowledge how you're feeling and write it down. Cancer treatment can bring on several unexpected challenges: emotional, physical, mental, financial, and social. So listen to me when I say, you do not need to be strong at this time. What you do need is to express how you're feeling. Talking to a professional or joining a support group online can really help. Meditation and daily affirmations can also help. Educating yourself about how you can make healthy lifestyle changes can help. And sharing your story with others can help. Try to figure out what will help you the most and incorporate it into your daily life. The fastest way to heal from treatment side effects and emotional stress is with the help from healthcare professionals who not only understand what you're going through at a deeper level, but they can also answer all of your health-related questions and provide valuable advice. There are several free support groups online and in most communities which you can ask your doctor about, or you can click on the link below this video to learn more about our personalized support programs, which are taught by medical professionals who have either been in your shoes or have worked with cancer patients and their families for over 10 years. Bye for now.